As we approach the end of this academic year, I want to send a personal message to all the IO's student members. I know that you have been strongly affected by the COVID-19 crisis. Since March, this has hit your studies and your vital hours in clinic. For many of you who support your studies with part-time work, particularly in therapies which had to stop during lockdown, there's been serious financial impact too. I know all the colleges have worked hard to minimise disruption by switching to virtual learning. While this cannot replace hands-on experience, it has enabled continuity in your studies. For those of you graduating this year, I know you have the additional challenge of starting practice in a new adapted environment that none of us could have predicted 6 months ago. Despite the uncertainties that lie ahead, I see positives for the future of the profession which you have committed to. The COVID-19 crisis has forced much rapid development in the health sector beyond education. The use of technology ramped up massively, as we all know, allowing some continuity of care during lockdown for osteopaths as well as across most of the health sector. Some 30,000 health professionals volunteered for NHS roles, and osteopaths put themselves strongly on the map with nearly 1 in 4 osteopaths volunteering. And the NHS across all 4 home nations developed a strong appetite for cutting red tape and making decisions at speed. One sign of this was that osteopaths were welcomed as clinical volunteers in Wales and Scotland, despite not yet being included as allied health professionals there. Some of these changes are highly likely to stay. Around half of all osteopathic practices offered remote consultations with their patients during lockdown, which I take as a clear affirmation of the skills and experience of osteopaths as finders of health, and a potentially useful service addition for our profession also. The profile of the profession is without doubt increasing, and we are starting to see more opportunities for those interested in NHS roles. Indeed, we have seen as many NHS jobs opening up to osteopaths in the last 2 months as we have in the last 2 years. In private practice, as we open up to the general public again, we see principals beginning to recruit new graduates, which will increase as more clinics reopen. We work closely with osteopaths across the world, and it is good to know that our European colleagues are reporting patients coming back in strength. We're also very excited to launch the IO's new digital marketing campaigns across social media, YouTube and Google, something that the IO has invested, researched and prepared for over the last 2 years. We hope this will kickstart the much needed promotion of who we are and what we bring to patients and the public in general. Here at the IO, we also have plans to provide more dedicated support for students. We will be setting up a new cross-institution student committee with representatives from each of the colleges. This will provide a voice for students to guide the work and direction of the IO. In the autumn, we will launch our new website with a new student and graduate hub. This is dedicated to support and resourcing tailored to students and for those just about to embark on your careers. This, of course, is in addition to all the services and resources that all members can access. You are, we know, the future of the profession. All of us at the IO are committed to see you graduate into a proud profession that is growing and thriving, universally recognised and accessible to all.